Randy, want to welcome you. This is our third or fourth, I think, where we do communication back and forth about the what I would think is the hottest thing helping people right now. There's something I got to say that makes you feel good when you actually have a structure and a system that works. Like where this company, even though they were small, they figured something out, the nuances of being able to um, have insurance, uh, not insurance per se, but health coverage for people and keep it inexpensive with that unique way of crushing the bill down. Um, what's also interesting to me is they want people to be well, so they allow for people to have their own doctors, their own naturopathic way, chiropractors and the like that are changing people's health and health situation, and yet we're they're crushing the industry in pricing. And you know, all the time we're hearing this kind of stuff, and we're seeing that. Sometimes you kind of feel that's bull crap, or it's just not real, or it's done nothing but show its face as being a real opportunity for people to, especially like families, family of four, saving $1,000 a month. I mean, that's a real number
At
on
minimum.
on an average, and having deductibles, PRAs, uh, that are for the whole family, and then not charging after the third kid. Who does those kinds of things? And the only reason why I can suggest that they do or are able to is because they negotiate the bill. And so I kind of want to talk to you about, I don't know what you know about that. I know that video that you show where that guy comes in and shows a video where it's a half a million and it gets reduced to whatever, 15,000, 25,000. Where are we at with under truly understanding that? And how does that like work? Is it automated? Like automatically a bill comes in and they automatically say this is what we're going to pay, and that's all that gets paid. And how do we ensure that the hospital is okay with that? You know what I'm saying? The hospital has to, I guess, agree
Yes, they do.
prior to a payment going off.
Yeah.
And that means everybody that's out there has a company that is not just private, but is negotiating your bills for you. And because they're a 501c3, they're bringing them down to a real industry standard, versus these super inflated hotel prices, half a million for 2 weeks, kind of a thing, where you had a doctor come in and say, mm, another shot, I mean,
Yeah.
another IV, let's do another scan. Let's radiate him some more. Let's, whatever it might be. And to me, that is super powerful because we're bringing on literally, um, 41 people have said we want to do this for an opportunity. And I kind of wanted to do this with you because I wanted to be able to show people not the opportunity so much, but I want to be able to convert people into using this themselves. Here's some of the nuances. I had to, when I first applied, um, the social that they require is not for gaining access for credit. So when we are doing our app, you do the app in all caps and you put the social in place. And the reason you have to put the social for now is because you end up with a um, check against the bank account because they create a bank account for you where you're holding your own funds. And so it's a unique thing because it's truly, Christian health sharing, health coverage, but it still goes into your own bank account. They show you how much goes in. They show you how much is being charged in an admin. and that admin is being paid out to people that are bringing people like you on board to get health coverage. But they have a niche, man. Randy, this is a big niche, and this is something
The
that
biggest thing I've ever seen.
it's the best thing I've ever seen for
Biggest.
for for helping a family get into a rate reduction of some kind that is substantial to change their life. And I and companies, like I just had a guy, let me see if he's on. Nope, not on. But he's like, dude, I got several companies. He actually, and I'll say this because he's not on, he'll probably never see it. He actually cussed me out in a text. I can't believe that you have gone so low that you're selling health insurance. And I just went,
Wow.
and
And now he's on board or he's not on board?
he's totally on board. I just responded nicely. I said, actually, it's the way Christians did it for centuries. If they had, issues with health, they would help each other out, just like the Amish community is. They don't do sex change operations. They don't do abortions. It's Christian health sharing. And they just have a niche where they're able to get the bill down so low, and the hospitals are willing to accept it because they're getting paid in 15 days, 20 days versus a year and a half with Blue Cross Blue Shield. And so they're willing to work, and they know that there's one that's going to go off the birth bond, and there's one, and they literally have two sets of books. And
That's right.
most people don't understand that hospitals carry two separate sets of books.
Go to insurance companies.
Oh yeah, they have to.
And they will never open their books to the general public. However, this company does. And Impact Health Share is a not-for-profit, non-insurance alternative to the gougingly high cost of health insurance. So it's a community of individuals and families and small business owners, and they pay each other's medical bills, where in insurance, there's no incentive to not pay a medical bill. But the bills are shared once they get repriced because it is a 501(c)(3). So by law, they have to be repriced down to fair market value. And so once they do that, then the bill is, then you know what you've got, what you have left over. For example, the $540,000 bill that went down to like 525,000. Okay, so now the member is responsible for what we call a PRA, a primary responsibility amount. That's
Deductible.
comparable. Yeah, it's comparable to an insurance deductible. And they choose the one that fits the family's budget. And in traditional insurance, you have one of those deductibles per family member, but not with us. This is the new way of doing things. Listen, Uber took over taxi. That was a $21 billion industry. Impact Health is taking over that kind of healthcare. Even Yahoo Finance wrote about this and said that we are the healthcare coverage of the future. We're going to make the others a dinosaur. We're working at that angle to like, because I'm never going to leave this type of situation. It's like I don't
Why?
need taxis.
Why? You
Yeah.
got somebody arguing your bills for you as a 501c and getting them down to industry conforming standard prices. You've got a super low monthly cost. You got a PRA, a deductible that goes for the whole family, and your rates are 70% less than insurance. And you got a 90/10, so you can go to any doctor anywhere and get coverage. And
And,
the cost out of pocket is better than an insurance company.
and
All,
we're,
all because of the repricing.
that's it. This is so popular. This is becoming so huge that we are experiencing double-digit membership growth month over month over month. And since February of last year to February of this year, we had a 61% growth rate from that month to the new month. 61%, that's huge. Over 20,000 lives have been touched by this, and they're only 4.5 to 5 years old. They're not even, but it's not like they have no experience. This was started by executives and a vice president from Medicare, which was a healthcare share. It still is in business. Major difference between us and the old ones, that these executives, they made these changes because they wanted this to be the one. And so with the other ones, you have to pay that hospital bill yourself. So what if you had a $540,000 bill? You're going to have to pay that. And then you got to turn that into Medishare and hope that it's covered. Well, I don't like that. The sounds of that sounds real bad.
Right.
So they just reprice it, get it down, and they kick out then, okay. So in that bill, there was what, 15,000 left, something like that. So the guy pays his PRA. It happened to be an emergency overnight visit, so we paid an additional $150. That shows up on our card. We get a card, and it's right there on the front, so there's no surprise to anybody. Okay, and there's a toll-free number on the back that, the hospital says, "Do you have insurance?" It's the first thing they say. You're dying, and as you walk in, and they're like, "Do you have healthcare coverage?" "Yes, I do. Here it is. Call the number on the back." They do that immediately.
The way God intends. And I say this because I've been looking for something that would allow for people. This is outside of the scope of this call, but I've been looking for something outside of the people literally praying for something, because every day people were asking me, can you give me a job? Can you give me a job? And I can't do that because I can't do this entity, a ministry, like I was able to do an old business. There's a trust element of people we onboard to work internally. And number one, they need to be free. They need to have gone through our program. You need to have personal relationship with me and with God. And, so there's a trust element. And with this, I'm sitting there thinking, okay, and this is what I think reignited ACN.
Oh
For
yeah.
people that don't know, American Communications Network, ACN, um, one of the oldest direct marketing companies in the world. They're a Fortune 500 company. And you got to understand, we don't, the negative connotation that comes with direct marketing, everybody agrees there, in my opinion, is the way of the future, period. Because what's going to be taking out is the middleman, and AI is going to completely wipe out everybody in the marketing space, the middleman, and it's only going to be the products that require nuances of sale that AI can't do. And it's going to require a direct marketing piece. So when the markets are crashing, when the money's exchanged from one type of currency to another, um, and when AI takes over, and God forbid, I mean, I don't even know what that looks like completely. Um, this type of organization, which it's already showing its head as being the dominant way of doing health share, this type of organization is going to make anybody that signs on as an IBO and does any kind of effort whatsoever. By the way, with the 41 IBOs that we've done in the last 2 weeks, whatever it's been,
Independent
um,
business owners, for those that.
independent business organizations through his advocates members, because of his advocates and the relationships, we've been putting people below you guys and that are generating funds for you guys already. And so I'm saying that because this is an answered prayer for me, because I wanted to give people an opportunity to have something. And number one, you got the product. Number two, you got ACN, direct marketing, already structured, already done the test of time, got past the 18 months. They're 30 years old. Anybody understands direct marketing companies are failed. 99% are failed within 18 months. And this one has stood the test of time. This one is the largest producer of energy resale. They got contracts with Edison and gas and all these, but I think they got a new kickstart because of impact health share. And I think that understanding of the need for people to have a reduction on their monthly, like talking to Patrick, Patrick's the number one guy in the company, 300 $50,000 a month. Poor guy.
Yeah, it's rough.
Um, he he's on all of our calls. Like this guy is on our calls. And I'm not pedestaling this guy, but it's showing the strength of, and he understands the amount of money to that he could earn through the sharing of health coverage, which is what everybody's looking for right now, especially coming up in the enrollment towards the end of this year. Everybody's going to be looking, and this meets all industry standard requirements for California to have health insurance. This meets that, and you're doing it privately. You're not supporting Blue Cross Blue Shield doing transgenders. You're not supporting these large insurance companies murdering children, unborn children, and that to me is a win. So anything we're able to pull away and gain and put more money in people's pockets, it's just a win. So if you guys have and want to get any quotes, I know I see a bunch of people on that are already, and this is going to be a good video for you guys to market with, um, for your clients to help them understand. Can Randy, you give an understanding? This is not the pitch necessarily for the IBO. If you guys are interested in the IBO, give us a call, and we'll hook you up. As a matter of fact, I'm just going to put my cell phone right here. And even if you reach out, just text me. And what I do is I put you in touch with a meeting and we get you set up on an IBO. Now, a lot of people are asking me, just FYI, um, if you're interested, Mark, let me know. I saw that. Cool. Just send me a text with your name and I'm interested in the IBO. This, guys, is going to withstand. And one of the things I brought on the Mazur, Patrick, the guy, the number one in the company, is in 2008, when I was moving into my 30-foot trailer, that dude's income went up. Why? Because everybody was running to try to find ways to save money. And ACN does that. ACN is, in my opinion, bulletproof, recession proof, because everybody uses health, internet, cell phone, gas, electric, all of that stuff is what ACN does. And so we're now with a bulletproof company for somebody that's interested in the IBO aspect, walking into the biggest recession that's ever hit America, in my opinion. And we got to do something about it. And this is, in my opinion, the way to get it done. But Randy, if you could do me a favor, I'm going to do, I'm going to guess you're going to ask to be able to share a screen. So I allow for you to be able to do that. If you can just walk people through why the health coverage is critical. So these guys that are on, and I see a bunch of names here that are already IBOs, can utilize this as a mechanism. And by the way, Brian, I know you're a church pastor. What's up, buddy? This to your congregations is huge. Imagine going in front of your congregation and saying, I know many of you can't tithe, and I appreciate that. This is a way for me to bless you. And here's why and how. And you explain that their now bills will get reduced because you're walking them in, and therefore turning their bills over to this link and source are blessing you as a church. And even if they didn't go to your church next year, you're still going to get receivables from their bottom line of what they're paying on their gas, electric, cell phones, health coverage, all of that stuff, which is huge. So I'm going into chiropractic offices. I'm going into places as an IBO that American Chiropractic Association. I did a cold call to the president, and he didn't call me back, but I did a cold call to the president, and I want to get him set up. And I left like this minute and a half message. Who knows? He might call me back. But I'm going to speed dial that dude, and I'm going to keep dialing him and keep dialing him. And I'm going to put all the associations on a dial list and just hit them, because if I get one, it's done. It's done. But Randy, go ahead and share and just explain to people the power of the health coverage and why it's better than what other people have out there existing.
Okay, let's pull up. I'm going to share the screen. Let me expand here a second. There it shows up. So I'm going to actually pull up this. These are the differences. This is what you want to see, right?
Yeah,
Okay,
perfect.
so everything on the left
It's
is
traditional.
all, yeah, it's traditional health insurance and it's why it's a dinosaur and why we are the ones that's true grassroots. You know, entrepreneurs love this, influencers love it, stay-at-home moms, uh, every small business owner to large business owner is in love with this because they're having a hard time staying afloat. And in May, 40% of all small business owners were late on their rent because they couldn't afford their health care coverage, which is on the rise.
By
Massive.
design, everybody's getting their rents increased, and that means all insurance is going to cancel. That means their employees are going to get fired. They can all be IBOs. They can all do new insurance policies through this and save money. This is a huge market. I'm sorry, Randy. Go ahead.
No, it's great. So they have super high monthly premiums, and we're saving on average, it says 30 to 70, but it's really about 72% flat. Like that's the actual average. And I've saved people between 90 and 95%. And by the way, I have zero healthcare insurance experience. And again, we are a healthcare share program, so none of us have to be licensed. You literally can walk in and do this. I don't care what your walk of life is. I do trainings 5 days a week in the morning, and I always ask the new people, who are you? Who invited you? And what do you do for a living? I love to hear that because I hear everything. People are calling in on our Zooms and they're at work, mechanics to, I mean, some of the biggest techie kind of guys from Silicon Valley. You know, Silicon Valley just, they're laying off thousands and thousands of people. It's coming to a screeching halt. So we are saving really about 72% average. Okay. And then they have that high deductible per family member. So we have a doctor that works with us. He's got 7 kids, plus him and his wife. What a beautiful thing. And every one of his kids with traditional insurance had a $7,000 deductible on their back, plus him, plus his wife. That's $63,000 out of pocket. Now, I can't see everybody now, but what I saw before I flipped into this was mostly guys. But imagine you're taking care of your family and everybody's got to go to the hospital for some reason that year. And now you have a $63,000 bill strapped on your back, plus whatever happens. Okay, with us, no, we don't do that. So we have, again, what's comparable to a deductible, we call it a PRA, primary responsibility amount. We have just one for the whole family. So here we have that doctor, 7 kids plus him and his wife, 9 people. He only has one PRA. So if all 9 go, doesn't matter. It's whoever hits the PRA first, and then it's done. For the whole rest of the year, they could go 100 more times and it wouldn't matter. It's covered. Okay. So that's a big deal. Actually, before I get to that one, another thing that traditional insurance companies do is they want to know how much you make. They're digging into your bank account before they even give you a quote. You know, what's your take home? As a doctor, I think that's none of their business. That's a scam. It's not their business. It's not their business. We go by the date of birth of the oldest family member in that household. Much more fair of a system. Okay. So then with them, you got to choose between their physicians and their facilities, and it's in the state you're in. With us, you're not stuck in a network. So if you're in California and you want to come to Florida for a great doctor that you heard about here, come on, cross the state line. We welcome it. Use who you want to use. You're not stuck in a network, not stuck with a physician. And you know, I tell this story not often, but this is a factual story. I had a friend in 2015 that lived in another state. They were diagnosed with what they said was a terminal cancer. I said, you know, if you want to use the doctors here in Florida, they're better than where this person was. And I said, if you want to do holistic, I'll help you while you're going through, because they were hell-bent on going through chemo. Okay. I wouldn't never choose that for myself. But I said, I'll help you. I'll get you to your appointments and, do whatever. And their insurance denied them being able to come out of state. 8 months later, after they didn't have anybody to help them, I would send some nutrients and things. The family members were throwing them out, so they didn't even have family support to get them through that. They were gone 8 months later, passed away. Had they been able to choose who they wanted and go where they wanted, they might still be alive. So even at the end, they were declared cancer-free. So they were like, okay, great. So I can stop the chemo, right? No was the answer. Because if we stop, it'll come back with a vengeance. Yeah, I kid you not. And he knew the writing was on the wall at that point. They were just going to take him all the way to the grave. Because your body can't handle that. Okay. So you're not stuck. That's huge. That's absolutely huge. Drug pricing, we have the lowest in the country. Okay. You have a choice with us. Once you're an Impact customer, you log into the portal and you can see the closest 10 pharmacies. If there's a prescription that you have been, diagnosed and prescribed, then you can go and look and see what all the pricing is. It's right there, lowest in the industry. So if you're 65 and above, a lot of those people carry extra Medicare Part D or, different kinds. You can literally just get rid of that because we have the lowest pricing anyway. So let's say it's for metformin, a diabetic pill, which, by the way, I believe is type 2s are reversible in 6 months or less from my experience. So if you have to get that prescription, let's say it might be $1.30 in one pharmacy, it might be $10 at another. You decide, do I want to make that extra 2-mile drive or not? Okay, so you're going to be able to see that. They have higher co-shares, co-pays, and provider fees. We have super low. So on their co-pay, they're always between 20 and 30%. So when does that copay usually kick in? So let's say you have a 2,500 PRA. You meet that PRA, and then you pay that copay every visit thereafter, the copay. Okay, and by the way, remember, every one of our bills gets repriced. So even if it's $100,000, and with us you have a 10% copay, with them you have 20 to 30, we reprice that down anyway. It's probably hardly anything out of your pocket. So the rest gets shared within the community, within that church body, if you will, of other people that are on our healthcare program. Okay, so that right there is huge. Another thing, if you really understand co-pays or co-shares, we have a cap on that. The other side does not. So when I say you pay a 10% copay, with them, you're going to pay 20 to 30%, and it never ends. Okay. With us, we cap it at 5,000. So if there's like tons and tons of bills, it doesn't matter. We still stop it at a certain cap. They never, ever will. Never. Okay. Then telehealth. There are medical doctors out there right now charging $5,000 a year for telehealth. I just want to have a doctor on call, and then I'm still going to pay for an individual appointment with him. Okay. The insurance companies may or may not carry it. If they do, you're going to pay extra for it, but most of them just don't even have it. Then medical doctors have picked it up. They call it concierge medicine. You can find it all over the internet. So that seemed to be the rage there for a while. And those doctors were cleaning up just by people that didn't want to walk in anywhere, and they didn't want to carry Blue Cross, Blue Shield, whatever. We just 24/7 include it into our memberships. So if you don't want to go get exposed to what's going on in the waiting room, you don't have to. Pick up the phone 24/7. You could have a doctor on the line as quick as 15 minutes. The longest wait I ever heard, and it was probably during COVID days, was 2 hours. I've never heard of a wait ever longer than that, but they always call you back. It's not like you're on hold. Okay. So we have it 24/7, no extra cost to our members. And then when you look at what's going on with the borders, it's very hard to tell who's who basically anymore. And so we've just had to have a flat rule about it. If you're coming in from Mexico, Guatemala, or Canada, and you have an ITIN and one other form of government issued ID, we cover you. Okay, so you can be covered. And so this company has over 20,000 customers, but when they first started, they didn't. And so they managed to get like 4,500 customers in their first few years in business. And they were like, we got to partner with somebody who's all across this country, who's been doing customer sales, and they're darn good at it. And so they found ACN. So that's the window, the partnership they came under. So there's this company already had billions in sales, millions of customers they had already acquired. They were an Inc. 500 company, direct selling association members. They already walked the walk. They've already done this. AAA, BBB. I don't know what the private Titans is, but it sounds pretty amazing. And so they were already a part of that. So Impact came in under that umbrella, and ACN already had a bunch of services. That's how they got the millions of customers. And so, ACN was doing great, obviously, because my company doesn't have billions in sales and millions of customers. I don't know about your small business, but I didn't have that. I didn't have all these credentials, Inc. 500, et cetera. So I like the fact that they partnered under a company that's been in business 30 years. I like that. Okay. And so they've already got the legalities and everything in place. So once they did that, then Impact Health shot up. Now Yahoo Finance is writing about us. And now we're getting the attention of big dogs like the Texas Association of Chiropractors. In their first 30 and 90 days, they have over 3,000 customers and 150 business partners. Okay, so they're doing fantastic. The Pennsylvania Association of Chiropractors has come on board. We have doctors all over the country coming on board, being providers. They're finding out about us. So when I call a doctor and I say, hey, I have Impact Health, I need to come in, get, whatever done. Oh, I've never heard of Impact Health. Okay, great. Call this number on the back, and they're on our program in 5 minutes. Okay, so it's nothing for them to get on. But if they want to get on with Blue Cross Blue Shield, it takes 6 to 10 months for them to get on there. All that red tape and bureaucracy is for the dinosaurs. We're not doing that. But we are absolutely disrupting this industry. And out of the top 5 health insurance companies, 4 of the CEOs gave themselves $100 million raises last year, or bonuses. And when Kelby's talking about the ethical things, I guess there's a pastor on here. Welcome, pastor. We have pastors all over this country hopping on board this because the other companies are supporting the mutilation of children. Not just, abortion and death, but they're supporting the mutilation, chopping off body parts of little boys, or when the girls are starting to maybe develop, they're chopping that stuff off, and that's being covered. And we all know that is like criminal beyond criminal. It's evil beyond evil. Okay. Just imagine this insanity so pastors love it because they can attach to a company that actually has ethics and morals. And, just that foundation alone is huge. We don't get into political agendas. We're not taking your dollars and paying for parades. It's literally right in there. You get to see it shared with the church body. And if I can, Kelby, I'll show a little video. I don't know if I have time. Okay.
Go ahead.
Okay. Everybody can pay attention to this. This is our founder. He was with one of the other healthcare shares and stepped down, and they formed this because, you guys, it's just literally beautiful, this program we have.
Hi, I'm Phil Chrysler, President and CEO of Impact Health Sharing. Healthcare sharing began in churches. You were asked to contribute to help Bob and Sue with their ailment. People passed the hat and you contributed what you could to help your fellow member in need. Then fast forward, you saw great things occurring in the Amish and Mennonite communities doing exactly the same thing. Then it got a little more formalized in the 80s with some religious-based organizations. And then the Affordable Care Act came along. That's really what propelled healthcare sharing to its modern day growth. You remember the individual mandate penalized you with a tax if you didn't have health insurance. But if you were a member of certain healthcare sharing organizations, you didn't have to pay that. Now we know the individual mandate has, of course, been reduced to zero. But in the meantime, healthcare sharing grew over 1,000% in the last decade alone. Why? Because it's an alternative to the high cost of insurance. Typically, you'll pay 30 to 50% less. Some reasons why: we're not for profit. So we have no profit motives that typically cause conflict between members, providers, shareholders, and the executive team. None of that exists with healthcare sharing, and certainly with Impact. You can stop overpaying, my friends. Here's an important statistic to understand why. Department of Health and Human Services says about 5% of the population account for nearly half of the healthcare spending that occurs in this country. Majority are healthy. They're overpaying, though, for the non-healthy. Insurance has become really no longer affordable. 80% of U.S. adults rank lowering their healthcare costs as their top concern. So why Impact? Well, we're rooted in the love thy neighbor approach, which allows us to welcome all races, all religions, all colors, all creeds. We were the very first healthcare sharing entity to launch this patented technology platform that really provides 100% transparency. This had never been done before in healthcare sharing, certainly not in health insurance. We have member-owned accounts. That way the money stays in your account. We have no network. You get to see any doctor you want. Again, providing full transparency on how all the money moves is something we're really, really proud of. And of course, you have no open enrollment restrictions. Membership begins the first of every month. You just got to finish that application by the last day of the previous month. We also have great pricing and programs for individuals, for families, for seniors, and for groups. And remember, friends, it's a comprehensive program for your health. So we have preventative services, maternity, accident, illness, and of course, injuries. You have access to telemedicine and an industry-leading prescription drug pricing program. Here is a quick video that highlights the opportunity for all of us to be a disruptor in the industry. Enjoy.
Healthcare spending made up 5% of total US GDP in 1960. In 2020, spending hit almost 20%.
National polls show Americans believe healthcare prices and drug costs are among their top pocketbook concerns.
Over the past 20 years, the runaway cost of health insurance has outpaced earnings and inflation, leaving our families with less freedom and less money. Families, small businesses, and individuals alike are struggling to find a way to pay for the healthcare they can't seem to afford. So how are we going to solve this problem? All over the world, technology is changing the way people and society connect and interact. The result? Countless industries are disrupted. But while the rest of the world has changed, insurance and the way we pay for healthcare remains broken and largely the same. What if there was a way we could all pay for healthcare that simply worked better and felt better than insurance? Well, today there is. We are Impact Health Sharing. We are a network of families, individuals, business owners, and small entrepreneurs who want to see the old way of doing things change. We use technology to connect tens of thousands of individuals and families across the nation to simply share and pay each other's medical bills. Old problems can be solved when people come together to leverage their sense of community with technology to control the cost of healthcare.
So, Randy, I just learned something.
Friends, what we are simply doing is leveraging your
Let
sense.
me put a stop on it. Okay,
Yeah.
go ahead.
These guys, for the first time ever, have a patented technology, which it's obvious what that is. It's where the bill comes in, and they've done a repricing structure immediately that goes back out on that bill and claims a certain amount of money is owed versus whatever they're trying to bill. and probably comes to a digital agreement and exchange for the money. They're going to let go of the need for, and you hit it on the head, like traditional health share. As you go to the hospital, you get a bill for 100 grand, you pay that. And then you got to go back to the health share and then ask them for the coverage for the 100 grand, and they don't have that. Or they're going to deny you on that, or they're going to give you an issue like they did with me on the last sharing program. So what captivated me was that technology, which I just found out was patented, and why I like this company so much. That absolutely blows my mind. And so we're coming into this explosive phase over the next couple of years. There's no doubt in my mind. There's 200. I wonder what the numbers are. Like, how many people are in traditional insurance? How many people are in private insurance? And what is the numbers right now of people in impact? How many people are in impact right now? Do you know that number?
So yeah, I know some averages, okay? So in this country, over 300 million insured. When you look at the other healthcare shares, they did something like 400,000, 600,000, somewhere in that
1
range.
million.
Yeah, you can Google that to get much closer on that number. They're very exclusive. We're very inclusive. So we will and already are surpassing, because if you think about it, the execs and the VP stepped down to create this. So we're going to pull the numbers. And this is the first time that they've ever allowed, the other healthcare shares did not do this. This is the first time that they've allowed people like you and me and anybody on here and the people that are asking for a new IBO number from you to actually get paid to be the commercial. So instead of TV media, internet advertising that most companies pay for, they don't do that. Instead, they put it in the form of a paycheck for us to be that commercial. And so that's why everybody else is like, every walk of life can actually be a part of this. This is a $4.6 trillion industry. That's why I talked about Uber. When I talked to somebody earlier, maybe it was on here. I do so many Zooms, but I talked to somebody, I said, when was the last time you took a taxi? I don't know, 10 years ago. When was the last time you took an Uber? I don't know, 2 weeks ago. So that industry's already been decimated, and that was $21 billion industry. This is 4.6 trillion. Everyone will know this name. This will be a household name for everyone because this is affordable healthcare where we're putting the money back in the pockets of the people, and we're not gouging the people. It's back in the pockets of families so they can pay for food. You know, if I got an extra $12,000, saving an extra grand a month, I got plenty of places to spend that. There was a reason why I, even as a doctor, did not carry healthcare coverage. If they wanted between $700 and $1,150 a month for me with Blue Cross and Ambetter, no, I can find other things to do with that. So it's just a no-brainer for 100% of the population to come over to this.
Hold on one second. Brian, you have a question?
Yes. Hi. You mentioned I'm a pastor at a church, and right now I'm at a small independent Bible church here in Williamsport, Pennsylvania. And I have a question for myself and also about church issues. But for myself, I'm 64 and I will be turning 65 in just a few months.
Mhm.
So I've been starting to think about Medicare and all of the things that go along with that. I was wondering if that would be a good idea for somebody trying to live in the private or not.
Yes.
Yeah, I did look at this Impact Health Share online this afternoon, and it does say you're required to have Medicare A and B supplements.
For over 65, yes, it is a
Yes.
Mhm.
Right, and then you can get the low rates, right?
Right. And so for Brian, for you on the privacy question, a lot of times people will equate taking on a premium with or a contract with the federal government as a detriment. And so long as the contract is done in a private side or style, number one, number two, so long as you're paying, which you are on Medicare, there really isn't an issue with maintaining your private side status. And again, it's all depending on how you do the contract. So we'll teach you how to do it. But getting parts A and part B, and then coming over here to Impact and utilizing the health share, I think the cost for an average person where you can go to any doctor you wish is $1,000 deductible and somewhere between 100 and 120 a month for a
Right.
65-year-old with parts A and part B. So you're going to have a little monthly premium over there on Medicare, and then you're going to have the monthly premium over here, and it's going to supplement, and you're going to have full coverage at nothing. And nothing. And
Yeah.
and that is amazing. Go ahead, Randy.
And right when you hit 65, your actual out-of-pocket monthly is $96. Very inexpensive, the cheapest in existence.
It was under 100, yes, when I
Yeah,
checked.
96. Yeah, I know that. I know right at 65. And your PRA is only $1,000. Again, the lowest in the industry. Doesn't exist anywhere else.
Yep.
Mhm.
Yes, good. Well, I was figuring I would have to do the Medicare thing anyway. And one of the reasons is my wife is also a church pastor, but here in Williamsport, but she's with a United Methodist Church, which is a large denomination that you've probably been hearing about.
Mhm.
But their health care is handled through their conference, which is here in Central Pennsylvania Conference, Susquehanna Conference, I think it is.
So we go to
And-
the big dogs and then we work our way down.
Yeah, but our situation is the conference requires her as a pastor to take their health care plan that they get set up with Blue Cross Blue Shield, I think it is, and we have to take their insurance, and I do unless I had something else better.
Let me jump in. Let me jump
Okay.
in. There's something called open enrollment. So once a year, they re-sign a new contract with Blue Cross Blue Shield. So
Yes.
at any point before they sign that contract, which locks them in for a year, we can get them. And we pitch them, number one, on the morals and ethics. Number two, the pricing for sure. And we just signed a huge church up at State College. And that's just one of many. We do shows on this. We do, different radio shows and podcasts. And one of our shows that aired last week, it's a private group, but they have a large audience. They had pastors from all over the country and in Canada calling saying, I want to add this. I want to do this. I want to bring it to my church. So all we have to do is get their attention. So whether it's her doing it or, Kelby making a phone call, Kelby's afraid of calling no one. He will call them. He can come in from the spiritual side gently and, set up an appointment. Could be with us, could handle it himself. But once we have that conversation with them, all we have to know is when's their open enrollment and get them before they sign it.
Right.
It's November.
Yeah,
Okay.
get that. We can get
My
all
wife-
of those churches affiliated before they sign that deal.
Yeah,
And the rates are going up.
For this.
All right, I'm not even asking about that. Please, let me do
They're
this.
talking about doing the conference.
Yeah, I
It's
know.
already signed for this year.
Yes, I know. I'm going to tell them that, please.
And they can call the conference office and talk to them. I
Yeah,
will
thank you.
gladly get the number.
All right, thanks. Okay, well, sorry, yeah, I hadn't talked to her about it yet, but and I appreciate that, thank you.
You bet.
What
Brian, let me give you something to consider, Brian, because this is something that it's okay to consider for you and your wife. The opportunity on the level of you being able to simply make a referral where Randy, Tom, myself do the legwork and talk to them about the product. It could go national right away, where you have literally tens of thousands of pastors realizing they're going to save their congregation tens of thousands of dollars annually individually, giving more opportunity for tithing, giving more opportunity for a longer term relationship, because they don't let go of insurance. They don't let go of those things to which they have to pay because the law is requiring or what have you. But you guys literally could be at the top of all of that from a commission standpoint as an independent business organization for about $300. We do the legwork. You don't do the presentation. We get them as a group and we introduce this to every church, United Methodist Church across the nation. Here's the biggest thing. This Blue Cross Blue Shield, they support transgender care. I don't know how your church feels about that. I know what most churches feel about that. And they support abortion. This is a Christian health share in tune with and in line with God's word, from a standpoint of Christians coming together and supporting one another to pay each other's bills, and at a 70% discounted rate because of technology. So seriously consider figuring out who that referral is, becoming an IBO, and let us make a phone call on your behalf. And that could literally change your life forever.
Yeah, thank you. Lori did say that she could provide a contact if we asked her to, but in my situation also, because I've been on her healthcare plan and I'm coming up to 65, they do require that I get off of it and get on Medicare. So personally, that's what I was kind of planning to do anyway. And then I heard you talking about all of this. And so I was thinking that actually might work out for me and for us. And if so, then other people like us too. So yeah, thanks for filling that all in. I was starting to think about some of those things too, but I had the personal questions about our situation to make sure that it would work, and I've got a lot of that cleared up now.
Great. Anytime, Brian.
Yeah,
Yeah.
just a quick question, Brian. I mean, and you don't have to answer it, but do you have any kind of retirement in place?
No, not really.
Here it
Just,
is.
well, I have XRP and some other key ones like XLM, but not actual 401ks or anything. No.
Yeah, the reason why people are flocking to this is because as I've stated before, there's the things to which people hang on to in an economic collapse, and no matter what anybody feels, we're not going to debate this. We are heading for a catastrophe as a nation, as a world. And and they're doing a money changeover system. AI is being introduced. Many people are losing their jobs across the nation. I mean, it's evidence. The evidence is there. We all agree on it. What they don't get rid of is their health covers, their cell phone bill, their internet bill, and what am I blanking on, Randy?
The TV was
The
another
TV.
one. During
Oh,
COVID,
yeah.
nobody got rid of it, and we have that as well. Actually, that's a slide I didn't show anybody. You want me to bring that back up?
Yeah, if people are wanting to see the products that are being offered by this company. Now, understand something, the health share end of this is a part of ACN and the comp plan, but there's a ton of other products that ACN offers. So go ahead, Randy.
Okay. It like disappears on my computer. I don't know why.
This
Hold
dude's
on.
got 55 tabs open.
You should see my
The
desktop.
most disgusting background screen I've ever seen.
It's horrible. It really is. And I don't know where it went, but let me just open everything then. Let's see. Nope, it's not in any of those things that I just pulled up. Let me just, I don't know how it disappeared. I keep that thing open all the time.
Randy, I got to tell you something. If somebody can give me something 14 times, and I'll be like, can you send that to me?
You are the worst of it. And that's great. I
I
don't
got a
mind.
lot going on, man. I'm trying to help
Tell me
people.
my IBO number. Okay. Okay, so let's see. Come on, share screen. I see can you guys see me? You can't, right? It went small.
Yeah.
Screen. Okay, so we want to exit. I found it. Now I'm going to show you guys. Okay, so share screen. There you are. See, it's getting pathetic. You're going to see part of that background.
Disgusting.
I had to open 5 million tabs just to find this. Okay, so here we go. So here actually, remember I talked about ACN and they've been in business for 30 years.
This is
So
other services, guys.
yeah,
This is the stuff people trust me. Security, that's a big thing. They have security services here. DirecTV Spectrum Impact. Sorry, I'm not trying to take this away. We just had a 2.7 billion breach of people's information worldwide, and it went on sale on the dark web for $3 million. ID seal for people that are interested in protecting their identity, quote unquote. AT&T, Zoom. I mean, it's crazy, but they have contracts, and generally speaking, almost every one of these, outside of Flash Mobile, it did save me money, but we got to work on something with Flash, and you know what that is, Randy.
Mhm.
The ability for us to get people's bills down through ACN, including health now, is unequivocal.
I cut my cell phone bill in half.
I did too.
Yeah. And we are working on it. I don't know if we can do a sneak peek for everybody, but here's the thing for those of you that are interested in joining Kelby's team with this. This company, we're going to be at tens of millions of customers. No doubt about it. Tens of millions of customers. I know y'all can see the screen, so I'm like trying to slowly go over 2.9 billion. Okay. It says may have been compromised. We're going to be doing a show either this week or next week. We're just going to get the owner of the company on to talk about this. So as Kelby rolls these things out and shares this information with you guys, you benefit. So this breach right here, massive, 2.9 billion people. That means everyone in America, everyone in Canada, everyone in Europe, because they all have, socials and things. They did sell it or attempt to sell it for 3.5. This wasn't the only copy of that data either.
Oh, sure. Yeah.
So we're bringing on the owner of ID Seal, which is a product under ACN. And if you want it, when Kelby does that show, you need to be an IBO with us. And that's gonna generate when Kelby starts talking about that, because he hasn't yet. And they monitor everything, and it's unbelievable what all it monitors for you. And it's also private. So with your data, et cetera. So he'll explain it. I can't explain it very well, but there's a show that we put all of this information on just in the last
Let me tell you
couple.
why I like ID Seal, because I didn't like it at first because it was about the social, it was about public, it was about
Yeah.
this is why I like it. You get to see who is tapping into your information.
That's right.
You
see
get
it
to,
all.
and which allows for you to remain private. You get to lock your accounts up. There's all kinds of things this company offers from a service standpoint. So that kind of changed my mind on that a bit, and I think that's a very positive. Um,
So if that's of interest too, put it in the chat to Kelby so that he
Yeah.
knows you, because Kelby's going to his whole database of 68,000 people. You people are the first ones to take a look at this, besides in the last, 2 weeks that we've started to talk about these things. We have the only recession-proof business that has like 4 of the things nobody got rid of in the COVID days and the lockdowns, and Lord knows what's coming, with these people. Monkeypox is the next one they're trying to unleash. So, it's insane. We're just trying to take a whole bunch of people with us to the promised land of freedom, financial freedom, breaking from the system, and these are the things that are going to do it.
Yeah, just FYI, Eddie, I posted a link to you directly under a direct message of the IBO to sign up. I also put a phone number there for you to text me when you're done. I also asked you what your name, your email, and your phone number is. If you guys are interested on getting the coverage for yourself, just do me a favor, send me a text message on the coverage, and I'll get you a link. The text for coverage is a cell phone. I'll respond there with a link so that you can sign up if you guys are interested in the business element, the business end, or the side hustle end. It doesn't take much to get this thing rolling because I'm doing what's called stacking. I didn't really learn about this. Um, but the element of stacking is critical to understand in direct marketing. So I have IBOs that I've already put 12 people under, and 5 and 7 and 8. And
Getting
so
crazy.
they're all they got to do is go get their services and they're going to have money trickle up. Obviously, that's going to keep growing and keep going down. And then they're going to have IBOs and they're going to have their IBOs have IBOs. And that's what the power of direct marketing is. So if you're
Can,
interested, yeah, go ahead, Randy.
can I give the 8 o'clock presentation and have them see the
Yeah,
full?
that's in an hour. If you guys are interested, go. I'm going to do some marketing on that anyway, Randy, but go ahead and put it in there if you guys are interested and want to consider an IBO. And look, if you are interested, don't worry about whether or not my link comes up. The style to which this company pays, I want to go as deep as I possibly can. So I am forced to make you money, and it's a good thing. It's
Yeah.
one of those things where it's like a giver's gain kind of a thought process. It's good that we are forcing you to have 10, 12, 20, 30, 40 IBOs, and you're going to be like, okay, so I got to really do this now. Just and Randy did it to me. She did it to
Yeah.
me 2 months ago, where she forced me to jump into this, and no, seriously, seriously,
Yeah.
but it makes sense on every level for people. And if you're interested either way on the insurance side or what have you, we do. This is how easy this is. If you're interested in the IBO stuff, just get your friends to come to either a 11 a.m. Pacific or a 5 p.m. Pacific presentation. That's it. What these guys do is genius. They identify who referred you, they put it into the chat, they do a breakaway room, and they enroll your friend. They enroll your friend under you. It's like that. It's that easy. I've never seen something roll up as quick as this. So, Randy, thank you from the bottom of my heart once again. And we will see you in an hour on the presentation. And I will be doing some marketing for the database and send that same link out.
Awesome. Sounds great. I put it in for tonight, 8 Eastern, and tomorrow, 2 and 8 Eastern. Also, I always talk in Easterns because I'm in Miami. But again, when you come in, let us know you're with Kelby. And we rename you anyway. We rename everyone in the room unless they're already on board with us and we know them. So you'll be with your team. This is your family right here. And this is where you stick and stay. Okay.
All
So
right, Randy. I will see you in 1 hour. Marcus, you were late. You're 1 hour late.
hopefully he's got the info. All right. Good night,
Much love,
everybody else.
brother.
I'll
But
see
I'll
you.
see you. I'll see you in an hour, Randy. Thank you.